of the studies on gum disease, periodontal disease, are testing people who have severe periodontal disease. And what I've learned through this journey is that it's even early to moderate periodontal disease that is impacting systemic health, impacting chronic inflammation in the body.
Welcome to the Fredrickson Health Show, highlighting expert practitioners from health, fitness, injury prevention, functional medicine, and integrative medicine. If you are into upgrading and optimizing your health, this podcast is for you. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here is your host, Dr. Robert Fredrickson.
Hey guys, welcome to another episode of the Fredrickson Health Show. Today we have a very special guest, Dr. Debbie Ozment. Today we're going to learn all about the oral microbiome, how our oral health impacts total health, and how this can be a key predictor and a key way to help our long-term health overall. I think a lot of people don't think about this. So Dr. Debbie Ozment has been a private practice dentist since 1985. She's a graduate of Oklahoma University College of Dentistry, where she served as an adjunct faculty member for 7 years. She then completed a master's degree in metabolic and nutritional medicine from the University of South Florida and is a diplomate with the American Academy of Anti-Aging Medicine. She was trained at the Mayo Clinic, and she's also a nationally board certified health and wellness coach. She also is the host of Vitality Made Simple, a weekly podcast committed to sharing practical, understandable, and fun strategies to enhance your vitality and health span. Dr. Ozment, thank you so much for coming on today.
Hey, thank you, Robert. And it was such a blast to have you on Vitality Made Simple.
Yes, it was a good conversation on magnesium, but today I want to focus on our oral health because I think this is a missing link, if you will. I think a lot of people think, they go to the dentist once or twice a year and they're good, but you had such an amazing TED Talk that you did a couple years ago that was really just kind of eye-opening to what bleeding gums have for chronic disease. And I don't want to steal your thunder. Can you kind of tell us about how you got into looking at health from the oral perspective a little bit differently?
You betcha, Robert. And I think right off the bat, I want your listeners to know that this is really not about teeth. It's really about systemic health. It's about chronic inflammation, all of the things that you work so hard for in your practice. That we think going to the dentist is about teeth, and often it is too much. But the research is clear that it's the oral microbiome impacting gut health, impacting vascular health, impacting the blood-brain barrier. So I got interested. Started getting interested actually in dental school. So I was in dental school in the early 80s. And at that time, the research was pointing to some oral pathogens that could impact cardiovascular disease. And we had to be so careful even saying impact. We would never say cause. I mean, you would just, be finished. But it made so much sense when we would see these inflammatory signs in the mouth of bleeding gums or an infected tooth or some kind of big draining abscess. It just made sense that it's impacting the whole body. So then I started my practice in 85 and had a boutique practice, a practice where I knew everybody and knew their likes and dislikes and their dog's name and their grandkids and
Of course,
just
yeah.
really very relational and very fun. So I started seeing that people were going to more and more doctors, taking more and more medicines at younger ages. And so that's what sparked my curiosity. The very first class I went to was big class was in 2010, and it was a vascular inflammation class given by some cardiologists. And there, I learned about a new saliva test at the time, the first one that could test for oral microbes. So that started the party.
That started the party. So what did you learn from those tests, and how did that start to change the way that you practiced?
I had started noticing at that point that people who were nutrient depleted. I mean, including magnesium,
Hmm.
including vitamin D, had more gum problems. So that was on my radar. So then I find this testing, and the specific initial test that was that I still use and love is by a company called Oral DNA. The broader term is salivary diagnostics. And so this oral DNA test looks for 11 different uh, gum, bugs that are in the mouth, bacterial oral pathogens that are causing problems. We focused at that time on what are called red complex bacteria. And quite a keystone study came out in 2012 looking at one of those big pathogens called Porphyromonas gingivalis. And it's an oral bacteria that in the study they found it in about 40% of brains postmortem in people who had Alzheimer's disease.
Interesting.
Interestingly, Robert, they in this particular initial study, they found it in 0% of the people who died at the same age and did not suffer from memory loss. So that was huge. So at that point, I was very focused on these what are called red complex bacteria, and there are three of those: Porphyromonas gingivalis, one called Tannerella forsythia. Couldn't find much research at the time. Now there's a lot. And another one called Treponema denticola. Now, Treponema really sparked my interest because I went to this class, came home, tested everybody that would, swish and spit, and just started getting results on people. Well, I had a little bit of Treponema denticola, and that was very, very alarming because in my research, I had found, in 2010, that was associated with blood-brain barrier problems, and also that it was associated with a root canal that was starting to fail, and
Mm.
yeah, I mean, I'm not against root canals, but we do know that root canals are sort of teeth on probation. So we have to, keep a close eye on all root canals. Well, I had one root canal in my mouth that I'd had at that point for probably 20 years. Had a little bit of Treponema denticola. Uh, my husband had a tiny bit of Treponema denticola and no root canals. Well, with further research, I found that this bacteria is transmissible. So it's transmissible, transkissable. And so immediately,
Wow.
yeah, yeah. And that was just like, whoa. Because I knew I didn't have gum disease per se. I've been very, very, picky about my oral microbiome. Wasn't doing everything right based on, what we're learning. But nevertheless, called an oral surgeon, scheduled to get my tooth out, went and got my tooth out, which is such a drastic move in those days. But I just felt like I needed to do an experiment and kind of, you know, check this out for myself.
Hmm.
3 months later, Robert, I retested my own saliva and Mike's saliva, and Treponema denticola was 100% gone.
Wow. Okay.
Yeah,
So
yeah.
it's an infected tooth,
It was, and it didn't
maybe.
hurt. It didn't hurt. At that point, we only had 2D x-rays. Now we have a 3D cone beam, and we can really evaluate root canals, top to bottom, side to side, and front to back. So now we can check that out radiographically much more uh, precisely. But in those days, it didn't hurt. It didn't look bad on x-ray. And my dental friends thought I was totally a nut. But but I know it was the right thing.
So when you're doing this oral DNA test and you've identified that one of these red complex bacteriums is elevated, you then use different diagnostics to kind of identify which tooth or teeth are infected and then make an appropriate, treatment plan around that to whatever it might be removing through a root canal or maybe something else. So because
Right.
I'm just thinking out loud right now. Like, how would someone who's listening say, "Hey, do they need to go talk to the dentist about taking this test through them, or is there now ways they can take it over the counter, or can they order it for themselves?" Seems like a big deal that a lot of people are missing Because I want to take this test right now just to see what my
Those
oral health
those
is
are
like.
great questions. At the time, it was so new. So most of my patients wanted to get tested. And what I learned is that uh, it was such a good way to assess things early. So many of the studies on gum disease, periodontal disease, are testing people who have severe periodontal disease. And what I've learned through this journey is that it's even early to moderate periodontal disease that is impacting systemic health, impacting um, chronic inflammation in the body. So I'll mention now there is a home test. It's called the Bristle Health Test, and you can actually order it and save some money. I have an access code, and so now via the podcast and people living somewhere else, you know you can test yourself. This is this new decentralized healthcare that I love. People can get educated and then find a doctor who is also educated. I mean, if someone brought a bristle health test to you, you will know what to do. And you may not, although you're not a dentist, you can, find the appropriate person to send them to because really, the message you're trying to get out and that I'm trying to get out on our podcast is look for curious healthcare providers that are still learning. And that's what's so fun about this journey. A wild thing happened in about 2013. Um, there's a physician in town uh, who was really the first functional medicine MD, and she had a patient that she was concerned potentially had cancer
Mm,
because, yeah, this person appeared healthy, but her C-reactive protein, that's a blood marker that looks at inflammation. It can be acute inflammation or it can be chronic inflammation, but it measures inflammation. Her C reactive protein was 18.1. And, now the blood test, they just say 10 or more. In those days, we could get a precise number, but 18.1 is crazy high. And so this physician said, Debbie, I'm afraid she might have cancer. See what you find. So we did this saliva test. She had some bacteria. We treated that with really just a deep cleaning, a really good cleaning, and then I utilized laser therapy. We did not use antibiotics. Um,
interesting.
yeah, based on the algorithms of the testing, it was pretty new. This was 2013, so 3 years later. But but I'm so glad we didn't. I mean, now based on things, I might look at it differently, and I would now do a stool test additionally. But we didn't know about that, so we just did this deep cleaning, use a laser, what I call laser cleaning, very much standard of care. Robert. I mean, that's the thing. This is what's so beautiful about this because the treatment's pretty simple and pretty inexpensive. And so she got tested, retested by her physician exactly 3 months after her treatment with me. And her C reactive protein had plummeted from 18.1 to 2.9. And
18.1.
yes, 18.1 to
Wow,
2.9.
that's really high.
Yeah. And so she, I mean, there was no other change in her life except, this oral microbiome therapy. And that's really standard of care. But we've looked at the mouth so often as carpenters, as dentists, we're very skilled at fixing teeth and, working in small spaces. But this oral microbiome is much more far reaching than I would have ever imagined, Robert. Now, the interesting thing on her blood test, not only did her C reactive protein drop, um, but her cholesterol got better, her blood sugar got better, all these other markers improved. So that is really what was like such an epiphany for me. And that propelled me to, jump off the high dive back into um, lots of education.
Wow. So do you think maybe she was producing extra cholesterol to try for more of like a protective mechanism because her body was so inflamed? It was trying to just kind of cover up some of these pathogenic bacteria or these red complex bacteriums, as you mentioned earlier. I mean, yeah, that's very
Yeah.
fascinating.
Yeah,
How
we
how
don't
all those,
know.
yeah.
Yeah.
Well, so I want to talk about treatment strategies, but I want to wait kind of towards the end of this to talk about that. In your TED Talk, you go into kind of lifespan versus health span. Can you tell us kind of what that means?
Yes, thank you for asking this because I think this is pertinent to every single person listening. The average lifespan in the United States is somewhere around 79 years when you average men and women. Of course, it's a little longer
And it's
for
going
women.
down,
It is going down. And
unfortunately, which is
yes,
crazy.
it is. It's going down, and it's these chronic inflammatory illnesses that are also zapping health span. Health span is a number that used to be really easy to find. It's so interesting. In preparing a lecture I gave last week, I tried to find current numbers on health span since 2020, and I could not locate those numbers. But health there's a HALE index. Pardon me, HALE, Health Adjusted Life Expectancy
Mhm.
Index. And there used to be a big list that you could find, but before 2020, although the average lifespan was about 79 years, the average health span was 63 to 67 years. So, or, 69. But the point is, people should be in a wonderful chapter 3 and they start going to doctors. And that's what I'd seen in my practice, Robert. They they just start going, to doctors. They'd be saying, "Oh, well, I've got to go to my heart doctor that day and my skin doctor that day and my foot doctor
Mhm.
that day and my dermatologist that you've seen it in your practice, and it's just this list of doctors and this increasing list of prescription meds and no improvement in health. So,
Yeah.
so
And
the
why do
points,
you want to, yeah, why do you want to work this hard to retire and to have all these ongoing issues that you could have addressed earlier, and now you're having to deal with them with a lower health span? It's mind-boggling. And the raising the retirement age, the life expectancy is actually going down for the first time ever. So, it's really not adding up. So we have to do something.
yes, we have to, and I appreciate everything you're doing because your book Magnesium Answers speaks to all of this, and I think people have to really think, okay, what do I want to do? You know, it, what do I want to be able to do? I want to be able to put my 30-pound carry on into the overhead bin. I want to be able to run and play with my grandchildren. I want to be able to uh, go on this hiking vacation. I think it's super important when you think about lifespan and health span. You can't just think, oh, I want to get old. No, I mean, that's fine, but you have to really think about why you want to be healthy. And it's typically, I think, a relationship based answer.
Yeah. Exactly. I mean, I want to get old and I still want to be strong. I want to be able to pick up my kids, from a crib. I want to be able to get up off the floor very easily. I want to be, the grandpa running around with my grandkids and, just doing all the active things. I'm very active and I want to stay active and, that's what makes me happy. And I think a lot of people, you know, if they start doing things early and start looking at their microbiome, gut and oral. They start moving, they start exercising, start eating a nutrient-rich diet, start taking magnesium, vitamin D, the essential kind of vitamins. There's so many things that people can do that they're not currently doing. And I think they can have a huge impact on our health span. So,
I totally agree. And I think, when we really think about our design, it always kind of goes back to our design, staying hydrated, staying active, getting sleep, not staying up all night on stressful things,
hmm
you know, uh, nurturing good relationships, eating real food, uh, re replenishing our body with things like magnesium and vitamin D and things that we're not getting in our current lifestyle as much, and not expecting to be sick. I think that's a big part of it.
yeah. I mean, yeah, and just reducing stress, all these basic things, foundational principles that they seem so easy. Everyone knows we should sleep more, we should reduce our stress, we should eat nutrient dense foods, but we get those messed up somehow.
Mhm.
And just this crazy fast paced lifestyle that we live in is not really set up to or conducive to allowing this to happen. And so anyways, I want to talk about still the oral health. And you mentioned some really interesting things in your TED Talk. And one thing that I want to kind of highlight is bleeding gums. How do bleeding gums contribute to chronic disease? And if someone has excessive bleeding, maybe it's from brushing or from flossing, tell us what you see more of. How do people say, hey, this is a kind of an early check engine light warning sign that people should get addressed quickly as possible?
Well, because bleeding gums are so normal, and Robert, I make fun of normal all the time. I say normal is, you know, dehydrated, irritated, frustrated, constipated, overscheduled, overstimulated, undernourished, underrested, inflamed, and totally stressed out. That's normal in our society too often. So bleeding gums are sort of that way in the dental office. Um, by all measures, in my TED talk, I think I said that globally, uh, gum disease, including early, to late, is about 80%. A recent study I read last week says it's 90%.
Mm,
And um, so so that, you go to the dentist, and I've been guilty of this before I understood it. Oh, you look fine. You just have a little bleeding. No, that a little bleeding can have a huge impact on health span. And in fact, the patient I mentioned earlier, that had this high C-reactive protein, she just had a little bleeding. She, I would have
from brushing,
ignored her years ago. I would have
just
said,
from
"Oh, you're fine,"
just
and
from
she would
just
have
from
just.
brushing her teeth, or
No, it's from, the bleeding is caused by pathogenic bacteria. Now, these bacteria are in our systems, but our immune system, keeps them at bay.
mm,
So they can overgrow. They live under the gums, in a calcified biofilm. So these, a biofilm is any, community of bacteria that protect each other. So they sort of protect each other. And so it can't just be a polish when you get your teeth cleaned. I mean, the thing about it, listeners, bleeding gums are never healthy. Healthy gums never bleed, never bleed. And it's not from brushing. You can't brush so hard your gums bleed. I mean, maybe there's some, very serious, obsessive compulsive disorder that could cause that. But generally, when they're healthy, they do not bleed at all. I mean, even during a cleaning, they do not bleed. So the point of flossing would be to keep that, biofilm disrupted so that it wouldn't reform. It can start reforming about every 24 hours. Now, I would never tell somebody not to floss, but I like to use these little, brushes, little gum brushes. And I thought here, I have one here. This will be on a podcast, but you may have it on YouTube. It's these little, curved brushes. They're plastic. So far, that's the best thing I can find. But when you get a really good cleaning and all of that, calcified, gunk under your gums where those bacteria live and breed, when that's removed, then you want to keep it removed daily by really scrubbing those surfaces under your gums with these little gentle brush picks. So it's pretty simple, Robert. Um, it's not a super fancy, uh, tool. It doesn't have to be expensive. There are certainly other things. Um, I'm currently about to get involved in a study to look at some other things that can help, but this is certainly the place to start.
yeah. So if people aren't flossing, definitely start there. And so just give it, yeah, some basic, let's go to very ground zero for basic hygiene, oral hygiene principles that people should be doing.
Well, I would actually say start with these little brush picks first, because they can really help you decrease inflammation. I was in Nicaragua years ago on a medical mission trip, and in Nicaragua, all we did was extractions pretty much. So I would clean people's teeth while their mouth was getting numb for their extraction. And I would occasionally see someone who just had these super healthy gums, or people would hear, oh, you know, this dentist will clean your teeth. So they would have me look at their mouth, and it was rare, But in the people who had healthy gums, they were using like a chew stick. They called it a chew stick. And Robert, they would get a little twig and, pull the rough stuff off and use that between their teeth. And that's when I came home and was like, okay, I've got to find some options. Well, there's been options and options and options. And currently, this little curved gum pick is my favorite option. The whole point is to disrupt that biofilm, that community of bacteria before they form. My big interest is in a bacteria called Fusobacterium nucleatum. That is that's an orange complex bacteria, not a red complex. So
Okay.
in 2010, there wasn't much research about um, Fusobacterium because it doesn't cause grave damage in the mouth. I mean, it does cause some, but it causes far-reaching systemic damage first. It's after the TED talk, a German researcher wrote to me and he said, Debbie, this is causal for colorectal cancer. I think the TED talk was actually 2018, but so that was new research. And now if you go to PubMed and put in Fusobacterium nucleatum and colorectal cancer, you're going to get a pile of research that's going to blow your mind. And I've seen it in real terms that it disrupts the gut in a myriad of ways, including inflammatory bowel disease. We know that it really stimulates plaque formation in the brain. It's involved in breast cancer. Robert, I've never seen Fusobacterium at happy levels in a person who was suffering from a serious chronic inflammatory disease. It's always high.
Wow.
Hmm.
I feel like just this is kind of missing from that integrative functional approach is the oral piece. We do everything else with the testing, stool testing, blood testing, stress testing, list goes on and on, right? But then we miss kind of some of this component if we're not looking. So how would someone, I mean, of course, you're always going to look at the oral piece, but how do other practitioners say, hey, like all these markers are still high. There's high inflammation. There's definitely something going on with the microbiome. What would lead them to clue in, hey, maybe it's the oral health? Start asking questions versus their hygiene practices. Do you have bleeding gums? What signs and symptoms would a practitioner look for?
You're very intuitive, Robert. I appreciate it. If a practitioner uh, like you would happen to do a stool test, I utilize the GI map. There's lots of good stool tests.
Hmm.
Um, a stool test that tests for Fusobacterium in the gut. That would be a big marker that there's a problem because it only got to the gut from the mouth.
Mm,
Fusobacterium is an oral bacteria that translocates to the gut. So we know that we have to treat it in the mouth to impact the gut always. So I learned this by accident. So many things are by accident. You trip over it.
uh-huh.
Um, a physician sent a patient to me probably in about 2017, 2016, and she'd been treating Fusobacterium in her patient's gut, and her patient would get well, feel better. She would treat it with Flagyl, metronidazole, and she'd get better, and then she'd feel good, and then she'd feel bad. And then she'd feel, they treat it again. Oh, it's back. It's back. Well, it was in her mouth. And so it has to be treated in the mouth. Now, as a quite a significant piece of news that we can all use is that there is so much compelling research about how Fusobacterium can cause colorectal cells, and now we know breast cancer cells, to be resistant to some forms of chemotherapy. It actually, Fusobacterium makes cancer cells resistant to 5-fluorouracil, which you'll commonly see as 5-FU, and also to cisplatin. That's the very most recent research is cisplatin. And I've seen this in real time with my patients. My practice now is I don't have a regular restorative practice. I just see physician referrals and help people with their gut problems with the gut starting in the mouth. So we see patients that are actually undergoing chemotherapy with say 5-FU, and it's not working. Once we treat that Fusobacterium, oh my goodness, now the chemotherapy is working. It's just so exciting.
Yes, so super exciting. So, if you don't mind, what would be kind of some of the oral treatment strategies that you might utilize for someone who's got some elevations in these red complex bacteriums or maybe even orange complex bacteriums that you mentioned? So,
Well,
is there a certain mouthwash that they use? I know you've already mentioned kind of the gum pick, but is there more intense measures that you do, and how does that process work?
well, if they got tested with their dentist, then their dentist that does the test would understand how to treat it. If they did a bristle test, the home test, then they would need to find a dentist who understood it. But the general treatment would be to determine what level of what's called scaling and root planing is necessary. That's based on pocket depth around the teeth. Now, Robert, it is standard of care to have a comprehensive periodontal exam annually. And I can't stress that enough. For anybody listening, when you go to the dentist, it should be a full formal exam, a comprehensive periodontal exam that is early detection of gum disease. It can help detect, if a tooth maybe has a vertical crack, it can detect a root canal problem, an implant problem. It's standard of care that we learned about in 1981 in dental school. So it's certainly not new. That's a long time ago. And so if you have a dentist that doesn't get it, find a dentist who does, because there's plenty of great dentists who are understanding that this oral microbiome is not just about teeth. We want good teeth, but the effects of early gum disease are bigger. Now, for listeners, you might be like, "Oh, my gums don't bleed," because you've been told no big deal. No, if you can get a toothpick or anything and kind of, gently go around your gums and you get bleeding, you've got some gum disease. So therefore, I would recommend ordering a bristle test. I don't know if I'd said that. I'm not good at codes and stuff, but Vitality 15 will save you $15, all caps of Vitality 15. But you can do that yourself. Bristle will send you an incredible test for yourself, and you can take it to your dentist and you can, say, "Hey, help me with this." And every office knows how to do a scaling and root planing. Every office doesn't use a laser, but I think that's a real key. Now, on another note, this measurement can be uncomfortable. So I think a lot of offices maybe don't do it because if you've got even early gum disease, it's inflamed, so therefore it's sore. I mean, the inflammatory process, creates redness, creates swelling, creates bleeding. Think about inflammation on your big toe. It's all the same. It's inflammation, it's pain and swelling, redness. So the I use a little type of anesthesia, not a shot, but a gel on the gums, Robert, to do the measuring so that I can get an accurate early detection measurement that doesn't hurt the patient. Because I understand why some offices don't want to. It takes some time for one thing, but it also can be uncomfortable if people are inflamed. But the
Yeah.
but the the option is to wait till it's really bad, and then it's gum surgery, or then it's tooth loss, or then I mean, this is early detection.
Yeah.
That's what you're all about. That's what I'm
Oh
all
yeah.
about.
Yeah, test don't guess. So is this evaluation like when I go to the dentist, they always say like one, one, two, one, they're looking at the
Uh-huh.
depth. Is that the
It
same
is
thing?
six
Okay.
points around every tooth. It
Okay.
is.
So they're always doing all these numbers and all the time and evaluating last time. And so if they see something is getting bigger, they say, hey, there might be a problem at this tooth or this segment. So anyways, but then if there is something going on, you do this test. You would use like a gel or a laser if your dentist offers that, some kind of treatment like that. Is
Deep
that what
cleaning.
I'm
Yeah. And your
understanding?
dentist will know. Mhm.
Okay, perfect. Okay, cool. I want to talk about maybe some controversial type questions. Hopefully, I don't put you on the spot here, but what are your thoughts on fluoride type toothpaste? Because I know there's a lot of different questions, and people are like, are they safe? Are they not safe? Should we use them? Should we not use them? Should we look at different natural based options like hydroxyapatite? What are your thoughts on all of this?
My fluoride thoughts, it's a great question. And the fluoride thoughts obviously have changed over the years.
Okay.
Everybody used to get a fluoride treatment in my office till I understood that fluoride can be damaging to the thyroid. We know now that it can inhibit all kinds of mineral absorption. Um, we and people, if they're keeping their mouth clean and not drinking Cokes all day and not on a bunch of medications that dry their mouth out, they just don't need fluoride. And fluoride is kind of a response, maybe a band-aid. Now it does help decrease decay. We cannot argue with that. But again, the systemic effects are probably not worth it. I I called in a prescription this morning for a woman who's 85 and her mouth is the Sahara Desert. So the benefits for her outweigh the risk, but that's so rare. I do not recommend using a fluoridated toothpaste for, 99% of the population, including children. I mean, it can be super toxic. The key is to keep that biofilm disrupted, to keep your mouth clean. And because even people who do a lot of fluoride, they're not 100%, eliminating decay.
Mm,
So I don't. I also there's an ingredient in toothpaste that I don't like called sodium lauryl sulfate. It's a detergent.
mm,
Um, a lot of the whitening toothpaste can cause people to have sloughing of their mouth tissue, and that can, be very uncomfortable. So I think something really just gentle, a really basic toothpaste, hydroxyapatite is great. Um, and just find something you like, um, and use it. But then know that you really do have to disrupt that biofilm between your teeth, under the gums,
mm.
every 24 hours.
Yes. Yeah. So yeah, with kids, like my kids in particular, I know they swallowed the toothpaste, so I got them on kind of a more of a natural brand. It's called Rise Well. They use hydroxyapatite as the active ingredient, and so they kids love the taste, and I use the adult version as well. For whitening, is there any kind of natural based whitening? I know there's a lot of different options, but what have you found to be effective in that regard?
Well, there are a lot of options. Charcoal can do some whitening. Um, for some of my patients, I recommend chlorine dioxide. There's a product called OraCare, and
Or care.
it
Okay.
OraCare, yeah, and you get it through a dentist. But it's the side effect is that it kind of whitens teeth. So that's a good thing. Um, and there's just, I think, anything pretty basic. Um, it of course it can be, if it's in a toothpaste, Robert, it can be an acid they're using, and that can be very irritating.
Okay. So thank you for clarifying that. And yeah, Andrew Huberman did a big thing on, even just fluoride levels and just basic groundwater can cause, issues of the thyroid if it's over,
Mm.
a point. I can't remember the exact numbers, but it was very, very small parts per million. So I looked at my water supply where I live in Central Texas, and I was way over that. I mean, it was pretty alarming. I was still in the quote unquote safe levels. But I was like, wow. So a lot of people don't realize that, there's a lot of contributing factors. We live in a toxic world, so we have to be resilient and kind of avoid toxins as best we can. I'm lucky and fortunate to have a whole house water filtration system, and we use the natural based toothpaste and, additional water filters, but still, I mean, there's so many different things that are coming at us at all times. And one thing that I wanted to mention about the oral health is there's some controversy behind this as well, and it's mouthwash. And I've heard several different people, and I've actually had people on the podcast that have talked about kind of the prescription mouthwashes like chlorhexidine are detrimental to nitric oxide producing bacteria. They can reduce that in the mouth. But then there's thoughts on maybe other mouthwashes aren't as bad. What are your thoughts on mouthwash? Should we be using them? Should we not? Is there certain brands that we should be looking for?
I th- that's such a great question, because I think in our world we want this one thing that's going to solve the
Hmm.
problem. We
Yes.
want to spend money and make it all good. Well, I think these over the counter mouthwashes that kill 99.9% are bad. They do inhibit nitric oxide. I've had patients get off of those and their blood pressure improves
Mm,
because nitric oxide is so essential to blood pressure control. Um, Dr. Nicole Burns has done a lot of work in this area. Dr. Nathan Bryan has done a lot of work. And it comes back to, less is more. Now, there are some excellent mouthwashes by Biocidin. Um, you might hear it pronounced Biocidin if you're not from Oklahoma, but you're pretty close, Robert, to me. And but what I offer my patients now often for simplicity, I think people are easily overwhelmed, is that I tell them to rinse with some good sea salt water. So and I happen to like Baja Gold. I interviewed um, Michael Silek from Baja Gold, and we talked about just the high mineral and micronutrient nutrient content of Baja Gold. Also, it's just a delicious naturally harvested sea salt. I do not sell it. You can get it lots of places, but I like it because they test it for heavy metals. They test it for glyphosate and other pesticides, herbicides, and they also test it for microplastics. There's just a lot of microplastics
Mm,
in some of these sea salts. So that
they're
if
everywhere.
they're everywhere, they're everywhere. And so someone wants something just pretty simple. And there are good naturally based mouthwashes, but if you want something really simple, think about just some good salt water. The studies are incredible on just salt water. And interestingly, a lot of the studies, even before we realized that, say the brand names that you all know, uh, when they were the only ones, even then the study said that if somebody would just vigorously swish with a mouthful of water, that was almost as effective as the mouthwash. It may be, Robert, that the swishing mechanism is just dislodging some of that, and that's really the main benefit.
Yeah, swish some water around your mouth, get some of the bacteria out. So on that topic, I mean, oil pulling. So oil pulling is kind of where you take like a coconut oil or an MCT oil and swish it around your mouth. Is there any research behind that you found? Do you advise oil pulling? Does it work?
I have not found any compelling research, but yes, it works. So I
That's
think it's
not
what
that's my kind of hypothesis as well.
Yeah,
So
it works. I see it work in patients. Um, so so yeah, you take a little bit of coconut oil or whatever kind of oil you like, hold it in your mouth, and you vigorously, suck and swish, and you can add some essential oil to it if you want to. But Robert, it does work, and I like it. It's an Ayurvedic uh, mouth cleansing procedure. Goes way back. There's not going to be any big studies on it because it costs 3 cents to do. So there's not going to be studies, but why not? And I've never seen uh, any side effects. Now that's news we can certainly use. No side effects. Now, I don't I don't see big evidence that it, cures everything. You'll see that, that it cured whatever, sucking all these toxins out. I don't know. I haven't seen that. Um, and I always say if it doesn't empty my dishwasher for me, then, you know, it's not a miracle. But it is a piece of mouth cleansing. It certainly is a piece. It's a very easy thing to do. Again, I love things. Thank you for bringing that up because I love things that anybody can do. It's not something that costs $30 a bottle. It's
mhm.
it's a little bit of coconut oil, a little bit of olive oil, and accessible to everyone.
Yeah, I'm the same way. Find things that are very easy, sustainable movements, simple stretches, simple exercises, oil pulling, another very cost effective type of thing. But also, yeah, we got to spit out the oil just for people who aren't, some people say if there's toxins that are getting released or bound to, we should spit them out, probably preferably in the trash, right? Not in the sink.
Right, right, right. Not coconut oil in the sink
Yes.
and shower.
So kind of, rounding this conversation out, which I've loved this conversation. It's been so insightful for the oral health that I think is kind of a neglected piece of the puzzle. What are some other things that you like to advise your patients on from diet, exercise, nutrition? supplementation. What are some key findings that you find in your patients and also the practitioners that you work with?
Well, I always recommend that people drink plenty of water. I like people to do a little simple skin test to see how hydrated they are. It's so easy to be chronically, unintentionally dehydrated. Um,
What's the skin test?
you can kind of squeeze the top of your skin, um, like on the back of your hand, and if that little fold of skin stays up, you're dehydrated. You want it to snap back. So even in me, I'm 65, and of course my skin's going to snap back a little more slowly than say in your on your hand, Robert, but it still snaps back fast. And if I'm dehydrated, it just kind of stands up like a mountain ridge. So um, it really can help because it's just so easy to be chronically, unintentionally dehydrated. I mean, it's just there's so much goodness in our world. I mean, coffee, everything. So I always have people stay hydrated. That has a lot to do with their saliva in their mouths. Once your mouth feels dry, if you're thirsty, then you're super dehydrated.
Mm,
Of course, I always want people to know their vitamin D levels. So to just ask their practitioner to measure their vitamin D. I encourage people to when I'm seeing someone, Robert, they're sick. So I'll have them, we'll do their testing, and I'll generally have them eat more real food, whatever that is, whatever's right for them in their circumstance. But more real food that doesn't have a label, doesn't have a long ingredient list.
hmm.
Um, I really love fermented foods. We've been doing a lot here with fermented yogurt. That has helped
Nice.
so many people to repopulate the gut. Um, I always want people to move, just like you said, just very, functional movement, do something they love. I entertain the neighborhood kids by shooting baskets, and then they're just like, "Oh my gosh, she's out again." But I, love to shoot baskets.
That's awesome. Yeah.
Yeah, and so find something you love, whatever it is. I do hula hoop in the backyard, so that doesn't freak them out. But but and then of course to nurture relationships, have fun. I think having fun, humor, just relaxed time is actually a health strategy that we easily overlook, so easily. I talk about some detox methods. People need to sweat. We're designed to sweat. We're designed to poop every day. So, I have people look at that. It was so funny, Robert. And when all this started, say, really kind of started, my curiosity started about 20 years ago. With just noticing these changes. But I would start to ask my dental patients, well, tell me about your bowel movements. And so, like, they would be like, non-existent. I mean, so many people said non-existent. And so, that's where the constipated comes from. I didn't realize. But so that's just knowing. I think people being aware of their own bodies and knowing, my body is designed to evacuate every single day, every single day. And so I probably missed a few, but it's those basics that our ancestors would have been doing.
Right.
Uh, yeah.
Sometimes we make things a lot more complicated than they
Yeah.
have to be. And it's kind of just be boil it down as simple. Move every day, poop every day, sleep every day, have a non-stressful day, be around people that you love, have fun, brush your teeth.
Yeah. Yeah. Use your brush pick, use your
Yeah.
chew stick. Yeah.
Take your magnesium.
Take your magnesium for
Yeah.
sure. Yeah. You're going to be better around your people you love if you take your magnesium.
That's for sure. Yeah. As the kids say, facts. Yes. But so this has been a very fun conversation, and I really appreciate your insights today. I'm gonna ask some fun questions now. So I'm gonna put you on the spot. I didn't warn her before, guys. So the first question is, if you could put one or two health sentences on a billboard on one of the busiest streets in Tulsa, wherever you want the most people to see this message, what would your message be on that billboard and why?
It would be health starts in the gut, but the gut starts in the mouth.
Love it. Love
Yeah.
it. Okay, next question. If you could take one health related device, supplement, device again, what would you take with you and why?
It would be a brush pick.
I knew you were going to say that.
You
I
knew
knew
I
you
was
were
going
going
to
to
say that. I'm so predictable.
say.
But I've really just seen that work in lots of hands. People don't have to be super dexterous to use a brush pick. They need to be a little dexterous to use floss. Floss is not a natural movement. Brush picks are.
Love it. So the brush pick,
Mm-hmm.
brush pick or gum pick, right?
Yeah, yeah. Brush pick or gum pick or
Okay.
chew stick.
Awesome. So today's been very fun. We've asked a lot of questions, but is there any questions that we didn't go over that you'd like to cover?
Well, I think it's just what you're talking about so much in your podcast. Um, you're the boss of your own health, and never let any doctor anywhere shame you for asking questions, for gathering information, for reading good books like Robert's, for listening to good podcasts. You want to find a doctor who's curious and who respects your autonomy. That is absolutely essential for your health span. And then Robert, I would just invite people to look at bristlehealth.com. And if they want to get a test, they can use the code Vitality 15, all caps. It's not an expensive test, but they're going to learn a whole lot about not just their oral microbiome, but they also are going to get some gut numbers with that test. It's very, very informative. The Bristol folks do a beautiful job um, of educating and updating. I interviewed Danny Granick, who is the CEO there, probably about a year ago, and I was so impressed. I
Awesome.
really, again, like the area of decentralized health. And join me on my Instagram. It's just all hell. It's just all like it's fun, and I'm kind of new to Instagram, but I'm having a good time because I'm just doing some educational reels, things that are simple, things that are actionable, and that are not stressful. So, and thank
Yes.
you so much. You had such wonderful questions. I really appreciate your graciousness and the information that you're getting out, Robert.
Of course. It's been so much fun having you. And for everyone listening, yeah, tell us about your social media, your website, your podcast. Where can people find everything about you and learn more?
Well, the TED Talk is called The Forgotten Orifice, and you can understand why it's called that. My Instagram is Dr. Debbie Ozment. I have a YouTube channel, pretty robust YouTube channel. Just look up Dr. Debbie Ozment. Um, I'm on Facebook, but I'm not on Facebook. Things are on there, but I'm not good at responding there at all. But I really just appreciate the opportunity to get the word out because I want people to feel better, um, look better, and to enjoy better relationships. It's always about relationships, and people interact better when they feel good.
Yes. So many great points, so many great things to take away. Dr. Debbie, thank you so much for coming on today. It's been a pleasure to learn from you. And I know so many people are going to be impacted by this conversation. So thank you again for coming on.
Oh, thank you, Robert.
Have a great day.
Thanks for listening to the Fredrickson Health Show. This podcast is for educational purposes only and not intended to be used as personalized medical advice. Be sure to subscribe to this podcast so you don't miss a single episode. While you're at it, leave us a rating and review. Follow us on social media and subscribe to our email newsletter for more information.